Do you suffer from burning pain, numbness, tingling, or weakness attacking your limbs? It's time to declare war on the pain and inflammation of the nerves that are hindering your life. Don't let these symptoms control you any longer. In this video, I present to you a comprehensive and general guide to understanding this multifaceted enemy that attacks different areas of your body. And I will equip you with comprehensive and quick solutions to eliminate nerve inflammation permanently. Remember that nerve inflammation has many forms and types, which is why I prepared for you on my channel detailed videos explaining the treatment of each nerve individually. And before we begin this decisive battle, subscribe to the channel and activate the notification bell to receive every new support in our war on pain. Let's liberate your body from the grip of nerve inflammation. All right, let's delve deeper. Imagine the nerves in your bodies as a vast network of delicate electrical wires carrying messages and signals to and from the brain. Neuritis happens when these wires become inflamed or damaged, hindering their ability to transmit signals correctly. In other words, it's an irritation or damage affecting the peripheral nerves, which are those that extend outside the brain and spinal cord to the rest of the body. And the important thing you need to know is that neuritis isn't a single disease in itself, but rather an umbrella term describing a variety of conditions that affect these vital nerves. Now that we have a clearer understanding of what peripheral neuropathy is and how it affects the body, let's delve into the crucial question. What are the underlying factors and causes that lead to damage of these vital nerves? Essential vitamin deficiencies. Vitamins play a vital role in nerve health. A deficiency in vitamins such as B1, thiamine, B2, riboflavin, B6, pyridoxine, and B12, cobalamin, can lead to nerve damage and inflammation. These vitamins are essential for nerve function and the production of the myelin sheath that protects them. Spinal problems, pressing on nerves, issues in the spine, such as a herniated disc, spinal stenosis, or bone spurs, can put pressure on nearby nerves. This pressure can cause irritation and inflammation in the nerve, leading to pain, numbness, and weakness. Oxidative factors and their effect on arteries. The accumulation of free radicals in the body can lead to oxidative stress, which damages cells and tissues, including nerves. Additionally, oxidative stress can affect the arteries that supply blood to the nerves, hindering the delivery of essential oxygen and nutrients and contributing to their inflammation. High blood sugar. As mentioned earlier, diabetes can cause nerve damage over time, diabetic neuropathy. High blood sugar levels lead to damage of the small blood vessels that nourish the nerves, impairing their function and causing inflammation. Injuries or trauma. Compression, overstretching, or direct damage to a nerve can lead to inflammation. Infections. Certain viral or bacterial infections can directly attack and inflame the nerves. Autoimmune diseases. In autoimmune disorders, the body's immune system mistakenly attacks its own tissues, including the nerves. Toxins and medications. Exposure to certain toxins or side effects from some medications can damage nerves and cause inflammation. Types of neuritis or nerve pain. Neuritis can be categorized based on the specific nerves affected. Peripheral neuritis. This type affects nerves outside the brain and spinal cord, particularly in the extremities. Causes are diverse, including diabetes, vitamin deficiencies, and toxin exposure. Symptoms include numbness, tingling, pain, and weakness in the limbs. Cranial neuritis. This affects nerves originating from the brain, which control functions like vision, hearing, and facial movement. Examples include optic neuritis, affecting vision, and facial nerve neuritis, causing facial paralysis. Autonomic neuritis. This affects nerves controlling involuntary bodily functions like digestion, heart rate, and blood pressure. It can lead to digestive issues, sweating abnormalities, and cardiovascular problems. Brachial neuritis. This is an inflammation of the nerves of the brachial plexus, which is responsible for transmitting nerve signals from the spinal cord to the chest area, shoulders, and arms. It is characterized by severe pain and tingling in the shoulder area and may extend to the arm and hand and may be accompanied by muscle weakness. Motor neuritis. This variety primarily involves symptoms of weakness, loss of muscle strength, and muscle wasting. Sensory neuritis. This is characterized by numbness, tingling, or loss of sensation and paralysis in the affected area. Explaining the symptoms. So, how do you know if you have nerve inflammation? When nerves become inflamed, they send abnormal signals to the brain, leading to a variety of symptoms that can differ from person to person and depend on the type of nerve affected, the location of the inflammation, and its severity. It's important to be aware of these symptoms so you can seek appropriate medical help in a timely manner. Here are some common symptoms that may indicate nerve inflammation. Pain. Pain is one of the most prominent symptoms of nerve inflammation. This pain can be sharp and stabbing, or it may be described as burning, throbbing, or like electric shocks. The pain may be constant or intermittent and may worsen at night or when performing certain movements. Numbness and tingling. People with nerve inflammation often experience numbness or tingling in the affected area. This sensation may be mild and temporary, or it may be persistent and bothersome. It may also be described as a pins and needles feeling. Muscle weakness. Nerve inflammation can lead to weakness in the muscles supplied by the affected nerve. You may notice difficulty lifting objects, walking, or even performing simple activities that require muscle strength. In severe cases, weakness can lead to partial or complete paralysis. Increased sensitivity to touch. The area affected by nerve inflammation may become extremely sensitive to touch. Even a light touch or gentle pressure can cause intense pain. Problems with coordination and balance. If the nerves responsible for balance and coordination are involved in the inflammation, you may feel dizzy or unsteady while walking or standing. Changes in temperature or sweating. In some cases, nerve inflammation may lead to changes in the body's ability to regulate temperature in the affected area, or it may cause increased or decreased sweating. It's important to remember that these symptoms can also be caused by other medical conditions. Therefore, if you are experiencing any of these symptoms, it is crucial to consult a doctor for an accurate diagnosis and an appropriate treatment plan. Now that we've understood the causes and symptoms of nerve inflammation, let's move on to discuss the available treatment options. The role of B vitamins, antioxidants, and blood sugar regulation in treating nerve inflammation. Now that we've understood the causes and symptoms of nerve inflammation, let's move on to discuss the available treatment options. The role of B vitamins, antioxidants, and blood sugar regulation in treating nerve inflammation. Essential nutrients are an integral part of treating and supporting the health of inflamed nerves. Among these nutrients, B vitamins and antioxidants stand out, along with the importance of regulating blood sugar levels, especially for individuals with diabetes. B vitamins. The group of B vitamins plays a vital role in nerve function and health. For example, vitamin B1, thiamine, is essential for the metabolism of carbohydrates and energy production for nerves. Vitamin B6, pyridoxine, contributes to nerve function and the transmission of nerve signals. As for vitamin B12, cobalamin, it is fundamental for the formation of the protective myelin sheath around nerves. A deficiency in any of these vitamins can lead to nerve damage and inflammation. Therefore, a doctor may recommend taking B vitamin supplements to compensate for deficiencies and support the healing process. Antioxidants, such as alpha-lipoic acid. Inflamed nerves are exposed to oxidative stress resulting from the accumulation of free radicals. Alpha-lipoic acid is a powerful antioxidant that can help protect nerves from this damage and reduce inflammation. Additionally, other antioxidants found in colorful fruits and vegetables may help support overall nerve health. Blood sugar regulation. For individuals with diabetes, maintaining blood sugar levels within the target range is crucial for preventing or slowing the progression of diabetic neuropathy. High blood sugar levels can damage the small blood vessels that nourish the nerves, leading to their inflammation and damage. By following a careful treatment plan that includes diet, exercise, and prescribed medications, people with diabetes can protect their nerves and reduce the risk of complications. It is important to emphasize that these supportive nutrients should be part of a comprehensive treatment plan that includes consulting a doctor and adhering to their recommendations. These elements are not a substitute for other medical treatments, but they play a significant role in supporting nerve health and promoting the recovery process. The best foods to support nerve health and combat inflammation. Nutrition plays a significant role in nerve health and reducing inflammation. There are certain foods that contain nutrients particularly beneficial for nerves and can aid in the healing process. It's important to focus on a balanced diet rich in antioxidants, vitamins, and essential minerals. Here are some examples of the best foods you can include in your diet to support your nerve health. Fatty fish, such as salmon, tuna, sardines, and mackerel, which are rich in anti-inflammatory omega-3 fatty acids that are essential for brain and nerve health. Green leafy vegetables, like spinach, kale, and arugula, which contain high levels of B vitamins, antioxidants, and magnesium, all important for nerve function. Nuts and seeds, such as almonds, walnuts, flax seeds, and chia seeds, which provide healthy fats, magnesium, vitamin E, and antioxidants that support nerve health and protect them from damage. Whole grains, such as oats, brown rice, and quinoa, which provide complex carbohydrates that supply the body with sustained energy and contain B vitamins necessary for nerves. Legumes, such as lentils, beans, and chickpeas, which are a good source of protein, fiber, B vitamins, and magnesium, all contributing to nerve health. Antioxidant-rich fruits, such as berries of all kinds, strawberries, and oranges, which help fight oxidative stress and protect nerves from damage. Eggs are a good source of vitamin B12 and protein, both of which are essential for nerve health. In addition to these foods, it's important to drink enough water to stay hydrated and support nerve function. It is also advisable to reduce the intake of processed foods, added sugars, and saturated and trans fats, as they can increase inflammation in the body. When nerve inflammation results from a direct injury or spinal problems, the treatment aims to address this underlying issue to relieve pressure and irritation on the affected nerve. For injured vertebrae, treatment often involves conservative approaches such as rest, activity modification, and the use of pain relievers and anti-inflammatory medications. Physical therapy plays a pivotal role in these cases, focusing on strengthening the muscles supporting the spine, improving flexibility, and relieving pressure on the nerves through specific exercises and manual techniques. A back brace may be needed to provide support and reduce movement in some instances. As for other injuries in the body that have caused nerve damage or compression, treatment focuses on allowing the tissues to heal, which may include immobilization with splints or bandages, rest and cold, or heat therapy. Physical therapy is also an essential part of the recovery process, helping to restore movement and function and reduce pain through tailored exercises and individualized rehabilitation programs. In more severe cases, or when injuries do not respond to conservative treatments, surgical intervention may be necessary to correct the structural problem pressing on the nerve, such as removing part of a herniated disc or widening the spinal canal. The goal of all these treatments, including physical therapy, is to reduce inflammation around the affected nerve, allow it to heal and restore its normal function. In addition to traditional medical treatments, there are some alternative medicine options that may help alleviate the symptoms of nerve inflammation. It's important to talk to your doctor before trying any of these treatments to ensure they are safe and appropriate for your condition. Some of these options include transcutaneous electrical nerve stimulation, TENS. This treatment involves using a small device that sends mild electrical pulses through the skin to stimulate the nerves and reduce pain. It is believed that these pulses help block pain signals from reaching the brain. TENS devices are often used to relieve various types of chronic pain, including nerve pain. Acupuncture. This is a traditional Chinese medicine technique that involves inserting very thin needles into specific points on the body. Some believe that acupuncture helps relieve pain and improve the flow of energy known as QI in the body, which may aid in nerve healing and reduce inflammation. Massage therapy. Massage can be a relaxing and beneficial approach to easing nerve pain. Massage helps to relieve tension in the muscles surrounding the inflamed nerves, improve blood circulation in the affected area, which may reduce pain and promote healing. There are different types of massage, so consult a qualified massage therapist to determine the most suitable type for you. Yoga and meditation. Stress can play a role in exacerbating nerve pain. Practices like yoga and meditation help reduce stress and anxiety levels and promote relaxation. By calming the mind and body, these practices may help lessen the intensity of nerve pain and improve overall quality of life. Medical treatments to eliminate nerve inflammation. In advanced cases of nerve inflammation, medical treatment becomes necessary to relieve pain, reduce inflammation, and improve nerve function. The treatment recommended by the doctor will depend on the cause of the nerve inflammation and the severity of the symptoms. Common medical treatments include the following. Pain relievers. Over-the-counter pain relievers like ibuprofen and naproxen can be used to alleviate mild to moderate pain. For more severe pain, the doctor may prescribe opioid pain relievers for a short period. Non-steroidal anti-inflammatory drugs, NSAIDs. These medications help reduce inflammation and pain. Corticosteroids. These powerful medications may be prescribed to reduce severe inflammation. They can be taken orally or injected directly into the affected area. Muscle relaxants. If nerve inflammation is accompanied by muscle spasms, the doctor may prescribe muscle relaxants. Injections. In some cases, the doctor may recommend injecting corticosteroids directly into the area surrounding the inflamed nerve. This can help reduce inflammation and provide temporary pain relief. Surgery. Surgery is rarely necessary to treat nerve inflammation. However, it may be considered if the nerve inflammation is caused by a condition that can be surgically corrected, such as severe nerve compression due to a herniated disc or a tumor. It is essential to work closely with your doctor to determine the most appropriate medical treatment plan for you. You may need to try several different options before finding the treatment that provides you with the most relief. Remember that the goal is to alleviate pain, reduce inflammation, and restore the function of the affected nerve to improve your quality of life. Here we have reached the end of today's video about nerve inflammation. I hope the information I provided has been helpful and has given you a comprehensive overview of this issue and how to deal with it. Always remember that consulting a doctor is the first and most important step in your treatment journey. Because the topic of nerve inflammation is broad and diverse, we will be preparing special videos for each specific type of nerve inflammation in the near future. I will cover specific symptoms, detailed diagnostic methods, and specialized treatment options for each condition. So, in order not to miss these valuable videos, be sure to subscribe to the channel and activate the notification bell to receive an alert as soon as any new video is published. I am also always happy to read your comments and inquiries. Share your experiences and questions in the comments section below the video, and I will do my best to respond to them. And don't forget to like the video if you found it helpful, as this helps us spread knowledge and reach the largest possible number of people who may need it. We wish you all good health and well-being, and until we meet in the next video, may you be in God's care and protection.